The numbers in Gauteng continue to worry. While some COVID wards are nearing full, some have reached capacity, putting pressure on healthcare workers. And help is now on the way.
After the conversation with the President and the Minister of Defence and military veterans, we have requested additional capacity to assist Gauteng in terms of military help that has moved into the province to assist us swiftly. What this will do will be able to release the capacity of the beds that have been held because there were no human capital. So they will assist us in terms of moving into the hospitals, into the areas where we need healthcare practitioners to assist us in managing, because in terms of the beds, you have to have the human capital that is linked together with the beds that we are making available for managing the pandemic. The second area that will intervene and assist us is around mass testing and mass screening in community, and also the contact tracing. They will be able to assist us in terms of that, moving into Gauteng. So we are zooming into Gauteng, and today we are finalizing because the province has also asked us to help them in terms of ensuring that we can bring capacity.
A fire in April at the Charlotte Maxeke Hospital, which has closed the facility for close to 2 months now, has put strain on capacity.
The process is underway. We are hoping that in the coming weeks, the engineers will assist in terms of finalizing the work and also giving the certification for occupation of the hospital so that we can be able to see that coming back into life. We can now confirm by next week the oncology side at Charlotte Maxeke will be handed over to start operating.
South Africa also received an additional 300,000 vaccines yesterday for vaccination of school staff.
I can confirm that happened yesterday on the 17th of June. At 17:45, we received the consignment that arrived in the country, and Dr. Chris will go into detail because that has been identified as well to assist us for the teachers in the country together with other frontline in terms of police.
We will immediately start rolling out 2 programs and followed by others. The first one is the education sector. Altogether in that sector, there are 582,000 people. That's the public and the private basic education sector, including all those employed on Purcell, the SGBs and the private educators. Many of these people have already been vaccinated, some because they're over 60 and some because they work as psychologists and others who are registered as healthcare workers. But the majority of people obviously still need to be vaccinated. The second major program that is now in an advanced stage of planning and will roll out pretty much immediately upon completion of the teachers is the security cluster, starting with the police services, which planning is in an advanced stage. The South African Police Service is working together with Polmed and GEMS. About 145,000 people are covered through the Police Act and a further 36,000 through the Public Service Act. Those are the civilians working in the police services. Finally, there's also a program that is rolling at the moment for the South African Defence Force and for correctional services.
Over criticism that South Africa is lax and could have sourced other vaccines, experts say evaluation of these is not yet finalized.
For the Sputnik, the applicant, there are 2 applicants, and what they are doing is what's called a rolling review. So as they get data, they're submitting it to the regulator, and the regulator is reviewing that data on a continuous basis, and that speeds things up. That doesn't mean that you suddenly get a huge file of information that suddenly the regulator has to try and evaluate from all of those different perspectives. That really speeds the process up. They are still submitting some of that data, so we don't have all the data that's required for a complete review yet. So that's Sputnik. Sinovac, similarly, when they first applied, we needed more data. And so there's been ongoing dialogue with the Sinovac applicants, as with the Sputnik, in fact, as with all the applicants for these vaccines.
South Africa is expected to receive more than 1.3 million Pfizer vaccines via COVAX by the end of June. Criselda Lewis, SABC News in Johannesburg.